Good morning, and welcome to this week's episode of Ask Dr. Murphy. It will be our final episode of 2024, and we'll be back the week of January 6th. I hope everyone is doing well today. My name is Katie Berg, and I'm a research study coordinator with the Havey Institute. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well, thank you.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone U.S. COVID statistic through today, December 19th. We invite you to submit any questions or suggested topics down below or via any of our social media linked in the description. Starting with that COVID statistic, average COVID deaths per day in the last reported week were 49. In 2023, the same week, we saw 247 daily COVID deaths. Dr. Murphy, your reaction to those numbers and the state of COVID?
Yeah, so what's happening is the death rate is about the same. It's in the 40s, high 40s, around 50. This is markedly down from 2023. So that's a very good sign. However, as far as the trends go over time, what we're seeing is an increase in the wastewater detection system that we have, also emergency department visits. This is starting to rise in different parts of the country, just as expected. This is exactly what happens at this time of year with these respiratory infections. So flu is up, COVID is up, next will be RSV, and for flu, the test positivity rate rose to 5.1% at clinical labs this week. That was up from 3.5, so it's over a 50% increase, and it's increasing in 8 of 10 regions in the country. Emergency department visits and hospitalization rates also starting to rise a little bit, and the outpatient visits for flu-like illnesses are 3.4%, which is above the typical baseline. So it's starting. So this is just the beginning of the winter rise in these respiratory infections. Remember now, there are vaccines out there for flu and for COVID and for RSV if you're eligible. And now's the time to get them before this thing really takes hold.
Mm-hmm. And speaking about those flu vaccines, despite last year being, a devastating flu season pediatrically, it looks like those vaccination numbers are going down. Can you fill us in?
Yeah, they're going in the wrong direction. Despite these rises and 205 children dying from the flu last year in 2023, as of the end of November, just 2 weeks ago or so, just over 1/3 of U.S. children, 37%, had received their shots. This is down from 43% at the same time last year. So it's a 5% drop. And it's just really unfortunate because it can be life-threatening in children and in adults, particularly if the adults have underlying diseases.
Absolutely. And speaking of things that are very important, and our biggest story over the past few weeks has been the mystery illness in the Democratic Republic of Congo. And there has now been an identification. In your analysis last week, you talked about this a little bit, but now it's official. Can you break the news to us?
Yeah, after some serious investigation in the DRC, the Congo, they found that this is really just due to severe malaria. So there's at least 592 cases after they first got this alert. And the ministry in Congo, the health ministry, has said that the fatality rate is 6.25%, with 36 confirmed deaths. Now, many sources had reported up to 143 deaths, but actually when it was looked at really critically, it was just 36. Most of these are in children younger than 5, many of them severely malnourished. 64% of the cases were identified in toddlers, And it ends up all being pretty much, it's just malaria. I mean, which is just really unfortunate, because it's just a constellation of the malaria season with the rains and the mosquitoes, malnourished kids, without really good healthcare resources in the area. And it's just basically all this constellation of factors that lead to this increased death. Really very sad.
Absolutely. Very, very sad. And hopefully, on a much lighter note and happier note, there has been some extremely impressive research and clinical trials surrounding HIV prevention and some really huge news in that world. Can you tell us about it?
Yeah, we've had problems developing a vaccine for HIV. The treatments are great, but you have to take the pills all the time, even if it's just once a day. The preventive efforts have been, the drugs work great, but the impact has been relatively modest because people just don't take the medicine when they need to take the medicine. It just apparently is too complicated or inconvenient or whatever the reason is. So there's a new drug, lenacapavir, which is administered as an injection, but you only have to take this twice a year. It's very expensive, of course, if you get it here in the United States, but the cost of goods is actually about $40 for treatment for the year. And they did many studies, including some in California, in sub-Saharan Africa. They found it was 96% effective in preventing HIV infections, looking in thousands of patients. So they did it all over in Africa, and they've reported these results. And it's basically 90. If you take all the pictures, all the studies together, it's 99% effective. Of course, you have to come in twice a year to have the shot, but other than that, it works. It's just great. It's considered really a breakthrough of the year in preventing HIV. And there is an alternative, and that's the oral drug. There's two of them, tenofovir and the TAF version of tenofovir. And the actual efficacy rate for those oral regimens may be as low as 26%, because people just are not taking it at the right time. They're not taking it when they have unprotected sex, and it's just very unfortunate. So it's going to be a game changer. The one thing that's going to hold this back in the United States, the retail cost of HIV treatment in the United States, $42,000 per new patient per year. This is, it's a lot. Oral PrEP combinations is only $4. But like I said, cost of goods is about $40. So it's 10 times more than the oral form, but it works 4 times better. So it's going to really be a game changer.
Absolutely. And I, for one, and everyone here is very excited to see that go into action. Great public health, great research, and really great news. But coming back here to the US, there has been huge news this week over the avian flu in several different states. First and foremost, a very serious case in Louisiana, the United States' first severe human case. Can you fill us in?
Yeah, we have the first human case in Louisiana. There's been, this is a person who was exposed to backyard rather than poultry industry birds or cattle. This is the person also is the second person to be actually require hospitalization. But all the testing is still ongoing with people around that person and whatever. So it's just the next thing that's up. So it's unfortunate, but that's the way it goes. And we're going to see more and more of these cases.
Mhm. And how about in other states like California? There was some news from Delaware as well.
Yeah, they're all reporting cases either in laboratory sources or in emergency rooms or and patients that come in, and it's just it's popping up all over the place, basically.
Mhm.
Now,
And have there been
what's not happening is human to human. So that hasn't happened yet. So of course that's great, but just infected by birds like in your backyard. That's what's important about this.
Mhm. And has there been any updates on the raw milk situation, particularly in California?
Yeah, so over the weekend, the California Department of Food and Agriculture announced the second recall in raw milk. Um, this is a different producer, Valley Milk, simply bottled, after positive avian flu tests on bulk milk testing. So not a specific bottle was tested, but a bulk amount was tested. So far, even though they're finding it in now, several in this bulk sampling plus milk from a different distributor, a different product, no human cases have been confirmed in the people who consumed it. However, 2 cats got it from drinking the milk and they died. So it can be, pets can get it and can die of COVID. And it's just, it's not safe. Unpasteurized milk, which is raw milk, it can have all sorts of different bacteria and viruses in it. So, it can have avian flu, it can have salmonella, it can have E. coli, it can have Campylobacter, Listeria, Staphylococcus, Yersinia, Brucella, Coxiella, all these things can be in there. That's why we pasteurize milk. The benefit from raw milk, it just can't be worth the risk of getting these infections. Listeria in particular is very famous for causing abortion in women who are pregnant, causing miscarriage is the term we should use. And so this is a situation that's not going to go away. And raw milk is a dangerous product.
Absolutely. And the USDA then last week announced that by federal order, raw unpasteurized milk samples nationwide will be tested going into the future. So lots of acknowledgement on that front. My advice, stay away.
Yep, it's
But
high risk
yeah.
with very little, if any, reward, probably no reward.
hmm Now, our final story today is on the respiratory illnesses here in the US, but one that's less talked about and maybe should be talked about more. Can you fill us in and how much whooping cough we're seeing this year?
Whooping cough is like taking off like crazy. Um, and in 2023, there were some 6,161 cases in the US. This year, it's up to 30,000 cases and climbing. Last year, whooping cough is usually not fatal, but 3 people did die last year. 2 patients were under 1 year old, and a third was greater than 1. So far, nobody in this year has died from whooping cough. So the CDC does recommend that everyone 7 years of age and older, including pregnant women, receive the Tdap, the tetanus diphtheria pertussis, which is whooping cough vaccine. Infants and young children can receive the diphtheria, tetanus, and acellular pertussis, that's TDAP vaccine. A couple highlights of what's going on with whooping cough is, about a third of people that took this one survey by the Annenberg group, and, they didn't realize that pertussis was the same as whooping cough. So, when they're asked if they had the pertussis vaccine, there was no connection with whooping cough. So it's the same thing. Only 29% knew that all 3 diseases that the Tdap vaccine protects against, they didn't realize that it was all the 3 three different diseases that it was protective against. A total of 85% said they would recommend that an 11 or 12-year-old child in their household or an adult due for a 10-year booster get a Tdap. And 80% the vaccine is effective, so that's good. When shown a list of symptoms and asked which ones apply to pertussis, the only one nearly universally recognized was coughing fits. Low-grade fever is also common. Vomiting after coughing, they cough so hard that they actually vomit, and a runny nose. So in the news release by the Annenberg director, Kathleen Hall Jameson, urged clear communication. Instead of speaking about Tdap and DTaP and Tdap vaccines and using the unfamiliar term pertussis, public health communicators should reiterate that our best defense against whooping cough is the whooping cough vaccine. That's what we should just call it, and call it a day. But yeah, it's just another thing you can avoid if you just take that vaccine.
Absolutely. And on that note, I'd like to thank you, Dr. Murphy, for your time and expertise, breaking down all the data and illuminating all these stories for us.
Well, thank you very much, Katie, and have a great weekend.
Thank you. And thank you all for joining us for our final 2024 episode of the Ask Dr. Murphy series. We hope to see you back in 2025. If you have any questions over the holiday season, feel free to comment on any of our videos, and we will get back to you the week of January 6th. Have a great holiday, everyone.
Have a great holiday. See you next year.